Hi there, I'm Dr. Harshita. I'm a physiotherapist. If you have any kind of back pain, do watch this video till end and educate yourself. So let's get The condition which I'm going to discuss today is degenerative disc disease. I'll be telling you what exactly it is, what are the condition it is associated with, which activities can trigger the pain associated with degenerative disc disease, and what you should do to avoid the pain. Degenerative disc disease. Actually, this condition represents a wide variety of back pain, and this is a age-related condition. During the aging process, there are many changes in the body. There are changes in the bone, so there are changes in the spine also, there are changes in the disc also. These changes are normal, but these changes vary with those people who are having an history of injury back then at their childhood or in their young age, or from those people who are not doing any kind of physical activity on daily basis. So let me give you a picture how a healthy disc is different from degenerative disc. This is the healthy disc between the two vertebrae. This you can see the height, and this is the degenerative disc. In the degeneration of disc loses its height and it loses its hydration. It's unable to provide stability to the spine. See, degeneration in the disc can occur at any level, but it's very common in the cervical and lumbar area. And depending on the level of spine, depending on the condition with which degeneration of the disc is associated, depending on the severity of condition, patient may present some different kind of symptoms. They might present some weakness or some kind of numbness in that area, or patient might present some kind of pain which is radiating in nature in legs or arms. So today I'll be focusing more on the lumbar area. So let's talk about it. Now, to understand lumbar degenerative disc disease in a better way, let's have a quick look about the lumbar region. Lumbar region, it has 5 vertebrae, L1, L2, L3, L4, L5, and between each vertebra we have disc. Between L1 and L2 vertebra, the disc is L1 L2 intervertebral disc. Between L2 and L3 vertebra, we have L2 L3 intervertebral disc, and so on. Disc main function is that it provides cushioning to the vertebra. It acts as a shock absorber between the vertebra, that is, it takes all the extra forces between the vertebrae, and thus how it provides the stability to the spine. Hope till now you have got an idea about a healthy disc, its function, and how it is different from degenerative disc. Radiological investigations like MRI, they are helpful in detecting this problem. They're helpful in detecting the severity of the condition. Let me show you some MRI so that you can better understand the radiological appearances of a healthy disc and how there are changes in the degenerative disc. This is the MRI of lumbar spine, and this shows the vertebrae L1, L2, L3, L4, L5, S1, S2, and so on. And this is the spinal cord which runs at the back of the spine, this hole. And these are the discs which are placed between the vertebra. These are the healthy discs, and between the L4, L5 vertebra, this, and L5, S1 vertebra, you can see the space between these vertebra is very reduced. There is narrowing of disc, and these are the signs of disc degeneration. There is a grading of disc degeneration which varies from grade 1 and it runs down to grade 5. So as you can see in grade 1, the space is not very reduced, and as we proceed to grade 5, the disc space is very reduced. And this grading of disc degeneration, it helps the doctors to decide the treatment protocol for the patients. There are few common conditions in which signs of disc degeneration can be easily seen. First is osteoarthritis of spine. In this condition, we can see easily bony spurs, or in medical terms, this is also known as osteophytes. These osteophytes or bony spurs put a lot of pressure on the disc area. This we can see healthy disc, and this we can see how the bony spurs they put pressure on the disc, and this leads to thinning of disc. Next is facet joint arthropathy. Facet joint is the joint which is made by superior and inferior articular processes of the vertebra. And when degeneration starts in these joints, then they put a lot of pressure in nearby structures like disc. These are the disc. Thus how we can easily see the signs of disc degeneration in facet joint arthropathy also. Next common condition is lumbar radiculopathy. This is when one of the nerve in the lumbar area, that is this area, is compressed, and this puts a lot of pressure in nearby structures like disc, and thus how disc degeneration signs can be easily seen along with the radicular symptoms in the patient. Next common condition is stenosis. Stenosis is narrowing. There can be narrowing of central canal, which puts a lot of pressure on the spinal cord. We can see in this picture how the compression of spinal cord is there. There can be narrowing of transverse canal also, which puts a lot of pressure on nearby structures like nerve. There can be bony changes, like bony spurs we can see. And this narrowing puts a lot of pressure in nearby structures like nerve, spinal cord. Along with this, we can see there are signs of disc degeneration, as this puts pressure on the disc also. There are few activities which can increase the pain. The one is sitting. If you sit for long duration, like on a chair without taking the break, then it puts a lot of stress in the lumbar area. The other is bending or some kind of undue rotations or some kind of twisting if you do while sitting. Then it puts a lot of pressure on the disc area in lumbar region. The other is lifting. If you lift a heavy object from the floor, then it is likely that disc degeneration signs it can aggravate the symptoms and it can lead to some kind of disc bulging. If you are diagnosed with disc degeneration problem, if you have constant pain in lumbar area, then there are few things that you can keep in mind consciously, and there are few activities which you can practice on daily basis that will help you in reducing your pain. The first one is frequently change your position. If you are sitting for long duration, then stand and take a break. If you are standing and working for long duration, then sit or either walk around your office or around home, and that break will help in reducing the stress in the disc and the nearby structures in the lumbar area. The other is, if you have constant pain, then I would like to suggest you to lie down, and that will help you in reducing the stress again in the lumbar area and all over the spine. Most of the people, those who have back pain, they also have some kind of issues in their knee. Especially women, they are being diagnosed with the osteoarthritis. If you want to pick up an object, some kind of light object from the floor, so this is the golfer's lift. In this position, you can lift the light object from the floor, and this position will help in reducing the stress in the lumbar area and will not aggravate the symptoms. And if you want to pick up a heavy object from the floor, so you can bend the knees and then you can lift that object, and this will not put any kind of pressure on the lumbar area. You should do some kind of physical activity on daily basis, brisk walk or jogging. That will help you in reducing the pain in the spine, in the lumbar area, and that will help you also in mobility of the nearby joints. You should increase the water intake. An ideal water intake should be like 2 to 3 liters for an individual. In my previous video, I have given a brief outline about most common spinal condition. If you have not seen that video, watch it now. I'll be sharing the link in description box. Last, I want to say, watch your spine. If your back is hurting, talk to your physiotherapist, get yourself properly examined and get your condition properly. Since we are getting calls from patients for online consultation, so from now, with our services at our clinic, we will be also providing online consultation. If you want to take one, you can send the report on this number and our team will get back to you. And I'll be coming weekly with the videos on different topics. So subscribe this channel and stay tuned with us. Thank you for watching.